friends. I'm Alvin representing Armman. As it is seen on the slide, we are an organization that is working towards advancing reduction in mortality and morbidity of mothers, children and neonates. Our projects are focused on our vision, that is this. We are focused on developing and having a better life for women and children in urban and rural underprivileged communities in India. So moving ahead to the projects that Armman has, Project Hero, a helpline for emergency response operations. That is going to be the focus of the presentation today, and we will discuss the project much in detail. So moving on to Project M-Mitra. M-Mitra is basically Mobile Mitra, which is a voice message and animated film service for rural and urban communities in India. What we do here is we send direct messages on pregnancy and child care messages, preventive healthcare information, directly on the woman's mobile phone. Through this, what happens is we are trying to get more information to the women during pregnancy and childhood, and that will reduce perinatal mortality and morbidity, because women will then be able to take better choices for themselves and their babies. Moving ahead to the next project, that is the Arogyasakhi home-based care. This is basically provision of after-work hours, antenatal and childcare interventions at a nominal cost, again specifically for rural communities, because women there are always working, and the reason why we are focusing on after-work hours in this particular project is basically when a woman is at home, we try and provide her the service, and then she is more likely to take that service. But now moving on to Project Hero. Why did we think that we should work on a project like Hero? Why do we need Hero? So the need. I think each one of us can, identify with this particular situation. So just a quick question: how many of us in this room have ever faced a personal emergency or have been involved in a mass emergency where we're trying to find information on ICU beds? Can we have a raise of hands of people who have actually faced an emergency in their family? I think each one of us can actually connect with these situations here. I mean, we're sitting at the Taj Hotel. That's a picture from the 2008 attacks. What is the need? I mean, we do not have a system that provides real-time information on availability of emergency medical resources in India. At Hero, we are focusing on ICU beds and blood. Secondly, crucial time is lost. I mean, each one of us will understand this, that whenever we are in an emergency, we are trying to find out which hospital has that ICU bed where I can go to, or which blood bank has that A negative blood. I need it. I do not know where to go. I'm frantically calling up blood bank after blood bank. And we are losing crucial time in that golden hour. Now, if for those who do not understand what the golden hour is, the first hour after any emergency, after any medical emergency, is called the golden hour. And during that first hour, if proper medical care is given to the patient, then there are higher chances of the person surviving. So Hero is wanting to try and see that that golden hour is not wasted, because if it is wasted, it definitely results in loss of precious lives. So how do we do this? Well, focus on a few case studies. This is Hans Waghela, who lost his life, a child who did not get an NICU bed. Their parents were trying from hospital to hospital, and whenever they went to every hospital, the hospital said that, okay, we do not have an NICU bed free, you please go to the next hospital. Another story of Dr. Kadim said, after the 2008 terror attacks, he said that if we had better coordination, we would have saved more lives. Because constantly I had to shift my patients from JJ Hospital to KEM Hospital to Kama Hospital, and I didn't know where there was a bed available. A few stats. I mean, if you look at the accidents in Maharashtra, these are the 2011 stats. Maharashtra accounts for the highest number of accidental deaths in India. And to add to that, in Mumbai alone, we have 25,471 accidents reported, which is the highest among the major cities in India. Now, what is the solution that we want to offer? What does Hero have to offer? Here we have a person who is in an emergency, and what is the first thing that the person is looking for? He is looking for a hospital where he needs an ICU bed, or he's looking for blood at a blood bank. The problem is there's a gap in the information. He's not finding that information really accessible very easily. Here comes in Hero that will bridge this information gap. It will provide that real-time information on availability of ICU beds and blood very quickly, very easily accessible. And how do we intend to do this? We intend to do this by developing something called as the Hero Central Database. That is basically an ICT platform that the ICU beds, the hospitals and the blood banks will then push in their data, their real-time data of the availability of beds and the availability of blood banks on a real-time basis to the Hero Central database, which will then be transmitted to the person in need of emergency through these 4 modes. It is through a website, that is the Hero website, through a helpline that is attached to a call center, through the SMS, and through a mobile app. Now the interesting thing here is also that in the first hour after query, like for example, I give a query right now that I need information on an ICU bed available. So the Hero system will give you 5 closest hospitals. But for instance, if there's a change in those 5 hospitals, there's a change in the availability of the ICU beds, you get an SMS or a phone call from the Hero system telling you that there's a change in this, please move to the next hospital where there is an ICU bed available. Which will again, save that particular time that you don't go to a hospital where the beds are not available, but you go to a hospital where you find a bed. This is a rough design of how the Hero website will look like. We are in the process of designing it, and this website will also provide information on directions to go to these hospitals and blood banks. Contact details of the hospitals and blood banks will also be available to the website. Now, what is the advantage of a system like Hero? Number 1, access to life-saving information. Real-time information on availability of ICU beds is available. Hero will also ensure there's optimum occupancy in ICU beds in hospitals. I think we have a few doctors in the room today, and I would understand, they would agree with me that Mumbai has a scarcity of ICU beds. You go to any hospital today, the hospital will first say there is a waiting list of people who want to get into the ICU bed. But the point is that there are some hospitals where there are ICU beds vacant as well. So Hero, when it gives you that information, you will at least know that where these ICU beds are available, and at least we will try to be able to save those lives which can be saved in a situation like that. A real-time data tracking regarding ICU beds and blood group will help during critical times and mass casualties. Now, we were also thinking of in a situation like where there is a terror attack, and how will real-time information help? Because you will not expect the hospitals to try and send data to you at that point in time. But before a casualty is there, you will have the information that which hospital has how many beds available. And on the basis of that, you can actually plan out your plan of action. Where do you send the patients to? Which hospital do you send the patients to? And that, if we try and help in developing a disaster management plan, putting Hero as part of a disaster management plan of a city, that will definitely help us go a long way. That is why accurate information will actually help in future planning of services. What we've done in Hero is also this: we've created a barcoded inventory system for blood banks. Now, what does this barcoded inventory system do? It helps us to ensure that expired blood is never given to patients. There is a first in, first out system that ensures that wastage of blood is not there. So blood that comes in first goes out first. We are going to make sure that this software is installed in those blood banks who join Hero who are not computerized, free of cost. We will try and do that. And those blood banks can then start sending data to the Hero Central database. As I said earlier, that Hero can be a key component of the disaster management preparedness plan of a city. And that is what we are aiming at. This is how the blood bank software looks like. We have created it in 3 languages: English, Hindi, and Marathi. And it is basically for the city of Mumbai. So that is how it is in those 3 languages. Now the current status, what are we doing with Hero today? How are we wanting to reach the goal that we have set across? What we realized was that if a system like this has to happen, it cannot happen through a private entity alone. You definitely need to get the government into this. And that is the first reason why we started to do a pilot at Sion Hospital. It is one of the biggest tertiary care hospitals in the city and one of the most busiest hospitals. In a day, there are 300 entries, 300 people coming for care every day. And I'm talking about the inpatient department and not of the OPD alone. This is only the inpatient department where you have 300 patients coming on an average to the Sion Hospital. Now, what the Sion Hospital lacked was they did not have any computerized systems. Everything was manual. So once we got permission to start a pilot for Hero, the first thing that we did was to get the systems computerized, train the staff to use the computers because they were not computer savvy at all. It took hell of a struggle to make them aware that no, you have to do it. Because this is going to help in the longer run. And right now we are in the state of actually linking the Sion Hospital data with our Hero Central database, which is also created. And we are looking at what is this time lag that happens, looking at how does the data come in and how quickly does the data get updated from Sion Hospital. Similarly, we were also in talks with the Chief Secretary of Maharashtra, Mr. Jayant Bantia. He was then the Additional Chief Secretary of Health. So he was very much impressed by this kind of a project, and he said that why don't you guys also start a pilot at Thane Civil Hospital, which is a level 2 hospital. So we've received all the permissions right now to computerize the ICU database. The systems are in place, and right now we will start training the staff of Thane Civil Hospital to start computerizing the data in Thane Civil. Moving ahead, how do we intend to move ahead? Right now we have these partnerships. The first partnership for Hero was with Inscripts India Private Limited. It is a IT company which is agreed to come on board, and it is the company that is going to create the Hero Central Database. It is the one who is designing the Hero website for us, and they are like the lead technical partner in this particular project. The second partnership was with Plus 91 Technologies. Plus 91 Technologies develops hospital database management systems, and they have actually sold their database management system to a couple of public hospitals, that is Nayan Hospital and KEM Hospital in Mumbai. So we got them on board, and we got them to give us the software for a subsidized cost so that we could install it at Sion Hospital and at Thane Civil Hospital. Partnership with Apple Health Systems. Now, if you look at this entire system, you're talking about hospitals and blood banks, but we are not talking only of public hospitals and private hospitals. We are also talking about private hospitals here. That is why we've got Apple Health Systems on board, and they will be helping us in developing this system, giving the hospital database management system for private hospitals. Because some private hospitals would like to come on board, but they may not have the computerized systems. That is what Apple Health Systems will help us to do. Now, this was a very crucial partnership that we were able to do with Indian Medical Association. With IMA coming on board, it gave us a lot of credibility, number one, saying that, okay, this is a project that can be done, and it is needed to be done. And with partnership with IMA came the next strategy point of going and targeting private hospitals. So IMA has come on board last year in 2012, and we have now started approaching private hospitals and private blood banks to join Project Hero. As I've already spoken about partnership with the government of Maharashtra and the SBTC, the State Blood Transfusion Council, we need their support basically to have all the blood banks come on board, both public and private blood banks. Moving ahead, these are the hospitals who have agreed to join Hero. Well, we have some major hospitals like Kokila Jupiter Hospital, Hiramongi Hospital, Life Care Hospital who have agreed to join us. And these are the blood banks who have joined Hero till date. Now, the future milestones. Where does Hero want to go, or when do we say that Hero will be, fully operational? Hero, as I say, that Hero cannot be fully operational with a couple of hospitals coming on board. We need to reach to a maximum number of hospitals, and only then can real-time data can be displayed. So that is why this is our target. We want to reach out to 35 hospitals and 35 blood banks by the end of 2013. These 35 hospitals include 30 hospitals will be private hospitals and 5 public hospitals. Build partnerships with citizen groups and NGOs. The reason for that again is Hero can be successful only with the support of the public. Because hospitals at the first stage, this has been our experience, that hospitals at the first stage, they are very apprehensive of coming on board on a system like this. But with public support, we can actually drive them saying that, okay, this is something that the city needs, and hence you have to come on board, because at the end of the day, you are here to provide care. So why are you being so apprehensive about the fact? And that is why building partnership with citizen groups is very, very important. Again, launching a public campaign to create awareness about Hero. The Hero Central Database will be perfectly ready by the end of 2013, and the Hero Helpline website, the designs that I had shown you earlier. So by 2014, we will add 15 more hospitals to the existing 35 that I spoke in 2013. So we will be then reaching out to a total figure of 50 hospitals and 50 blood banks by the end of 2014. The Hero Helpline call center should be launched by then. We are already in talks with the Chief Secretary of Maharashtra to see how we can get a short code through the government so that it becomes like a public-private partnership. The Hero SMS service will also start in, where information can also be sent through SMS, and the Hero mobile app, which can be downloaded from the website. This is our team. The board of trustees, we have a team of 11 trustees at Armman. These include doctors, public health and policy professionals, management personnel, entrepreneurs and professors. So out of these 11, we have these 3 people. Dr. Aparna Hegde, who is the founder and the managing trustee of Armman. She is like the person who's actually leading the project. And as you see that we have a very small team. This is the team that we have. I form part of the executive team and my colleague Mr. Bipin Divakar is the project manager for Hero. So right now we are trying to push Hero with a small team because we do not have that kind of funding to get a proper team on board. But this is where we are wanting to reach out to. This is the team that is right now working towards taking Hero from the conceptual stage to the operational level. We have Indian Medical Association as our partner, and these are our 3 technical partners. So our team, Dr. Aparna Hegde, she is a very well-knit person. I mean, she is well connected in the government sector. She has worked herself in the Sion Hospital. At present, she is doing her fellowship with with the Cleveland Clinic in urogynecology, and she's going to be the first urogynecologist in India. She's going to come back in India for good in June. We received the People's Choice for Saving Lives at Birth event for our project Mitra, and we also received an award from DFID for implementing Project Mitra. Once again, Glenmark has agreed to support us to reach out to urban poor in Sion Hospital. So these are our few achievements of Armman for our other projects. Moving ahead as to what is this need, what do we require? This is our budget. If you look at the current budget, it is fairly small because we have a very small team and we are trying to see how can we maximize output with a small team right now. But in 2013 and 14, we are wanting to reach out to more hospitals. The capital cost is basically the cost for computerizing the systems in Sion hospitals or in public hospitals to use the computers and the printers there. The operating cost will include your personal cost, your staff cost, and in 2014, if you see the cost is increasing because we are wanting to start the Hero call center during that time. So at this juncture, what we are wanting to ask is the cost to run the operations for 2013-2014. Well, in terms of the sustainability plan, I mean, these are thoughts that we have, that how can we make Hero more sustainable? Well, we can definitely develop a partnership with mobile operators to generate revenue through the calls received on the Hero helpline. So that can only happen once the Hero helpline call center is in place. Partnership with corporate organizations to generate revenue for the project. A Hero mobile app that will be available for download from the website at a particular fee. The Hero website can also have relevant space for advertisement that will generate revenue. But all these things can come into place only once we have all the hospitals on board. So this particular plan is basically one that we want to achieve after 2013. But we are trying and thinking of how to plan it, how to go ahead about it from right now. So that is the request for funding support that we have. We need that to take Hero to the next level. Every city needs a hero. Well, we need you and me to be a hero. Well, it needs you, me and you to be a hero. So my request to each one of us in this particular room is that I know there are challenges for this particular project. I mean, I know that I'm going to get a lot of questions, but I also know this, that we are very committed to make this happen. No matter what the challenges are, we have been facing challenges for the last 2 years. We are going to overcome those challenges. We are going to make this possible, and we want to make this possible with your support, and that is the reason why I'm here today. Thank you.